10 habits that are damaging your kidneys that you're not aware of. Welcome to my channel. This is Nurse Merit. I'm a nephrology nurse. Basically, dialysis, kidney is my specialty. If you have any question in regards to them, either put them in the comment section or you can book a consultation with me or with any doctor you want by chatting on the number that is on the screen. It is a paid consultation. It is not free, but if you want for the free consultation, for the free chat, you can send me messages on my Instagram. Just bear in mind that it may take a little while because there are about thousands of messages there that I need to reply to. Now, having known about it, be aware that kidney failure is on the rise right now. Kidney failure is not a respecter of anyone. An adult, children, babies, pregnant women, anyone can come down with kidney failure. Even me, doing all the things that I can to prevent, can still come down with kidney failure. But God forbid, I reject it for myself and I reject it for all of you. However, there are things that you're doing that are putting your kidneys at jeopardy. These things are normal daily activities that you're doing every day. Please, you have to stop them. So listen attentively, especially if you're coming from my other media platforms. These videos are always different. Make sure you like. If you like and subscribe, hit on the notification button so that you get more videos from me. Now, number one thing that you're doing that are harming your kidneys is you're not drinking a lot of water. The estimated water you should drink in a day should not be nothing less than 1.5 liters of water in a day. You can drink more, but let it not be less than 1.5. Let's calculate 1.5 liters. You see the Nestle bottled water? Let me get it. You have to drink this at least 3 or 4 in a day. If you can drink more than 4, please, that's good. You can at least 3, nothing less than 3. For those some sachets water, you can take the same thing, at least 3, not less than 3. 3, 4 upwards in a day. This will hydrate your kidneys. Now, the habit of those when you're thirsty and whenever you're thirsty, you're not supposed to be thirsty. Actually, allow yourself to get thirsty. Okay, you're supposed to drink water even when you're not thirsty, but at any time that you're thirsty means your kidneys needs to be flushed. It means that you're exhausted, like a lot of processes has gone on, you've sweated, you're dehydrated, so your system needs water to flush some toxins out, to hydrate you and to flush the kidneys. So when you're thirsty and you are taking beverages, you're doing your organs a great harm. When you're especially taking caffeine when you're thirsty, because caffeine will make you dehydrate more. And not just caffeine can contain, you can see caffeine in beer, in coffee, energy drinks, Coca-Cola, and some cola products and some beverages that you're not even aware of. So when you are thirsty, the worst thing you can do is to take anything that has caffeine in them, because it will make you dehydrate you more. That's why you notice that when you take coffee or anything that has caffeine, you go to ease yourself the more. So this will not predispose you to having kidney stones. Reminds me that if you have kidney stones, you want to have a consultation with me on the treatment and of course the drugs that breaks kidney stone. Chat on that, book a consultation with me by chatting on that WhatsApp line and to get in touch with me. Now, number 2 thing that you're doing that is going to harm your kidneys is, of course, taking beverages or any other thing in place of water. This is not good. Number 3 is salt intake. You are taking a lot of salt. Please reduce the way you take salt. Salt will make you have high blood pressure in the future, and they are not good for you at all. Reduce the way you take salt. The normal amount of salt you should take in a day is 2,800 milligram per 2,500. Yes, for those that don't have high blood pressure, okay, which is a teaspoon, not a tablespoon. So you can see you're taking more salt in a day. Stop adding salt after the food has been cooked. This is a very bad thing to do. The next thing that you're doing, for those that have high blood pressure, your salt is half of a teaspoon, not tablespoon. The next thing that you're doing is that you are abusing some drugs. If you're abusing drugs like paracetamol, ibuprofen, which are non-steroidal anti-inflammatory drugs, they are older drugs too. If you're abusing these drugs, taking it at any slight of pain that you have, you are endangering your kidneys. So if you have any pain or anything, make sure you see the doctor. You can take these drugs 1-2 times, and the pain, if they are still there, please discontinue and see a doctor. Okay, when they give you these drugs, if they ask you to take it for 5 days, after 5 days, stop. Don't continue. Don't try to finish the whole drugs. Okay, now the next thing that you're doing that are harming your kidneys is you are not working out. Working out does not only benefit your kidneys, it benefits your heart and all your organs. Working out will help you manage your blood pressure, prevent blood pressure and circulation, and it will make the heart pump more blood to the kidney, which needs more blood. The kidney needs most of the blood that the heart pumps. The next thing that you're doing that is going to harm your kidneys is that you're taking alcohol, mixing alcohol with beer. This is the wrongest thing that you can do. This thing will damage your kidneys. It is enough that you're taking a lot of caffeine, a lot of coffee. Okay, caffeine, let me leave, because some coffee doesn't even contain lots of caffeine. It's enough that you're taking caffeine, energy drinks, which are packed with a lot of things that can damage your bone, damage your kidney and your heart, and then you're mixing it with another antidiuretic, which is alcohol. This is going to be triple action on your kidneys and your liver. Stop this combo. This will damage your kidneys and your liver and your organs. Have you heard about liver cirrhosis? Locate that video on how to cure hepatitis B, liver failure, and everything you need to know about your liver. The next thing that you're doing that is going to damage your kidneys is that you're taking your blood pressure lightly. If you have high blood pressure, don't take it lightly. Okay, high blood pressure and diabetes are the 2 leading causes of kidney failure in the whole world. Please, if you have these 2 conditions, stop taking it lightly. Make sure you manage your blood pressure and your diabetes adequately. I'm going to put the link of the videos that will help you on the description box. I'm going to put the link of the videos that will help you manage your blood pressure naturally, manage your diabetes naturally, and foods that you can actually eat with them. No matter what anyone tells you, as you're managing your blood pressure, as you're managing your diabetes, you don't have to stop your drugs. It is all those things that will tell you that will actually make the drugs work better. They don't substitute that you have to stop your drugs. Rather, as your blood pressure or your diabetes come down, the sugar level come down, your doctor will now adjust your drugs so that it will be adjusted. Instead of going up, your drugs, the amount of drugs you'll be taking will now be reducing. The next thing doing that will damage your kidneys is that you don't do your kidney function tests. You don't check your kidneys every year. Check your kidneys. Nobody is above kidney failure. It can happen to anyone. We'll be talking our videos on causes of kidney failure. There I will explain to you that there are some things that causes kidney failure that no one knows. It just happened and the kidneys are infected, the glomerulus are infected. So because it can happen to anyone, you just have to be checking your kidneys once in a year. The earlier you know, the better. The earlier you plan, the earlier you know it can be reversed. The next thing you're doing that can damage your kidneys is that you're not checking your blood pressure level and you're not checking your sugar level. Whether you are a diabetic or you're not, high blood pressure is a silent killer disease. It won't show you signs. You won't know that you're having high blood pressure until the kidneys are damaged or the person slumps or something happens. So once in a while, Check your blood pressure when you don't have anybody. Check your children's, check your mates, check everyone around you. Check their blood pressure, check their sugar level for them. Then if you find out that you have them, then please manage them, take your drugs. The next thing that you're doing that are damaging your kidneys is that you're taking herbal medicines. Now, there are herbal concoctions that are not good for you. In fact, herbal concoctions are not good for you because they don't have dosage. Even if they have dosage, they are not they are not prepared in the lab, which means that there are some quantity of drugs or of ingredients that are put in them that can damage your kidneys. For instance, we all know that drugs generally are not good for us, generally. But what makes it better than herbal remedy is that it is quantified. Let's say there is sodium chloride in a drug. So the sodium chloride that the body can tolerate will be 10%. But in herbal remedies, because it didn't check, they will put like 50% because they don't know. So that 50%, these two things are not good for your kidneys, but there's a lower quantity where your kidney can absorb. Meanwhile, there's a higher quantities that will damage your kidney. So you see the difference. The two of them has the thing, but one is higher, one is lower. So when you take herbal remedies that they don't know how, they just prepare it by shots, you can actually be ingesting something that is a higher quantity that can damage your liver and your kidneys, not just your kidneys. Please, herbal concoction, you should run away from it, especially the one that is trending in Nigeria or some African continent called Agbo. It has damaged a lot of people's kidney that I know of, about 200 people that I know of, because I'm a renal nurse, so I do dialysis. The next thing, so if for any reason you take some herbal remedies, make sure your doctor is aware of, and don't mix herbal remedies with taking your medication. You don't take them together, okay? Because it's going to add stress on the kidneys. The next thing that you're doing, this is plenty. The next thing that you're doing that will damage your kidneys is that you don't treat your infections. Leaving urinary tract infections untreated will damage your kidneys. If you have urinary tract infections, I have a video on how to treat urinary tract infections. You can actually also book a consultation with a doctor by clicking on that WhatsApp, or by chatting that WhatsApp. The doctor can help you treat this infection. Please treat your urinary tract infection. Locate the video of urinary tract infections, why it keeps reoccurring, because there are some people that treat it, it keeps coming back. There are reasons for this. When your urinary tract infection is untreated, it can travel to your kidneys and damage your kidneys. The next thing that you're doing that's going to damage your kidneys is that you're not urinating. Stop keeping your pee in your bladder. When you feel pressed, some of us keep pee. Sometimes it's not convenient, but let it be like once in a while. It should not be a habit, because the more you keep your pee, the more bacteria travel from the bladder to the urinary tract. They are all urinary tract, and from there it can cause kidney infections for you. And from there your wahala have started. Kidney infection is not a problem; it can be treated. Please, so you don't be scared, but most people don't know and they leave it till they damage the kidneys. Please, the next thing is that you're leaving some, have I talked about kidney stones? Yeah, some kidney stones are supposed to be removed surgically. Kidney stones more than 10 mm should be removed surgically, or consult with your doctor. Please, if your kidney stones are so big, it can actually block your urinary tract and prevent urine from causing stasis of urine, that is urine flowing back to the kidney, and this can cause infection for you and cause infection to damage your kidneys. The next thing that you're doing that are going to damage, there are a lot of things damage your kidneys, is please, as much as you can, try not to take expired drugs. Check the drugs before you take them, especially malaria drugs. Any drugs you're taking, make sure that they are not expired, and stop abusing drugs. There are so many things that can that you're doing, but that can cause kidney failures. But what we're dealing with is things that you're doing, habits that you're doing that will damage your kidneys. Okay, please, very, very important, stop bleaching your skin. If you're bleaching your skin, you are inviting kidney failure for yourself. Skin that has hydroquinone, mercury in them, they can damage your kidneys because your skin absorbs directly to your kidneys. Okay, so these things are nephrotoxic, they are not good for the kidneys. Very important, try as much as you can to stay in a chemical-free environment. For instance, after putting shelters or putting insecticides or whatever, or where there is painted newly, avoid those places and stop inhaling them. Okay, for now, these are the things that you're doing that is going to damage your kidneys. So if you have any question, put them in the comment section. We'll still talk about how to take care of your kidneys and what to do, the things. We'll even have fruits and food that are good for your kidneys. Okay, by now you should have liked this video. Have a nice day.